And welcome everybody to this podcast featuring YTI Career Institute. And we are here today to talk about a very exciting program, respiratory therapy. And we're also excited to talk about some breaking news where there's been a new accreditation. So my name is Ann Baldwin, and I'm joined today by Jim Bologa, who's the president and CEO of YTI and also PCI. But we're really focused today on YTI because, Jim, you just got some great news. COARC, which is the Commission on Accreditation for Respiratory Care, has allowed you at your Altoona campus to have a change in curriculum in respiratory therapy. So where should we begin? That's great news. But first, why don't you explain a little bit about respiratory therapy? I know we've heard a lot about it in the news lately with this coronavirus. It's kind of a emerging profession, if you will.
Yeah, well, Ann, thanks for having me, and I'm excited to be here and excited to talk about respiratory therapy. I mean, it's probably one of the most dynamic and technology-driven career choices in healthcare right now. And with the coronavirus and all that's been going on, I mean, it's predominantly a pulmonary-related illness. I mean, respiratory therapists are generally using high-tech medical equipment. And they're using their patient assessment skills that they're learning while they're in school, as well as in their clinical settings while they're being educated and trained, in the care and treatment of patients with these respiratory diseases. And again, some of their responsibilities in a clinical setting, may include, analyzing patients' their lung functions, determining levels of oxygen and carbon dioxide, performing, chest physical exams. Determine what kind of therapy is best for each individual situation. So, respiratory care technicians are generally, working along the bedside under the direction of a physician, and they'll work in a variety of different hospital settings, including intensive care units. They'll manage ventilators and artificial airway devices for patients who can't breathe on their own. In pediatric units, they're helping kids with respiratory conditions, ranging from premature birth to asthma, and in emergency rooms, they're assisting in life-saving treatment. So it's a little bit about what a respiratory care technician would do, and given the coronavirus, and again, as I mentioned earlier, this is a pulmonary-related virus, and as a result, it impacts your breathing. And so right now it's a great time to be a respiratory care technician, and they're integral and essential in the healthcare environment.
So it used to be that folks studying respiratory therapy went to your Altoona, Pennsylvania campus, but now that you've gotten approval on how to change delivery of this respiratory therapy program, things are going to change a bit, right? So it's not necessarily all in the brick and mortar. It's more, again, virtual learning. And then a lot of what respiratory therapists do are their clinicals. So to me, this is kind of freeing people up a little bit to study respiratory therapy from afar even.
Yeah, no, absolutely. I mean, with the recent change in our accreditation through the programmatic accreditor, COARC, they obviously have approved us for this new delivery method, and then our institutional accreditor, ACCSC, has also approved us. So that's the nature or the steps, the progress that we have to go through to become accredited in a distance learning or blended learning environment. Mm-hmm. And to your point, we're really excited about this, because what this now does is it opens up our program to prospective students really across not only Pennsylvania, but really all of the Northeast, and really all over the country if we choose to do that. Mm-hmm. Because what students are going to do is, even though the program is housed out of our Altoona, Pennsylvania campus, they are going to, the new program that's starting July 20th, they are going to be enrolled in taking about 3/4 of their program, their didactic learning, which includes lectures and simulated projects and simulated lab work. That'll all be done online, mm-hmm. and then the remaining 26% of the program will be done in a supervised clinical setting, where they hone their tangible skills, using this high-tech gear in the clinical settings that I had mentioned earlier in the podcast. So we're really very excited, because it's going to open up for us a larger area of potential students who might have some interest, but either don't have the time or the time of day to attend a program.
It gives more flexibility, like you said.
Yeah. So we're excited about that, and we're in the early stages right now. We actually have some prospective students outside of Pennsylvania already. We have some students actually from the Baltimore, Maryland area who've reached out to us, who've heard about the program, and and again, my expectation is that we would at least in the immediate future see prospective students coming from possibly Pittsburgh or Philadelphia and
anywhere.
Anywhere really, but
right.
in some of the bigger cities where there's maybe there's not as a robust program or a group of programs. So I think that we're really quite excited about it. It's really going to change the the face of the program, and again, we've been at this now in our Altoona campus since about 2012 when we first started the program, and there's a lengthy process that you have to go through with COARC in terms of getting the program accredited. And again, accreditation, I mean, I try to often explain to folks that it's a form of a quality system for education, and again, it's very similar to if you're in the manufacturing world, ISO 9000 or something like that. There's a set of standards that we have to follow, and that ensures that we have a quality program.
Well, and it's a 21-month program too, and I also understand that YTI is grandfathered in to this 2-year program, where a lot of the other respiratory therapy programs you have to have that 4-year degree. In this case, it's like I said, it's grandfathered in, so it's less time with the same career path. Correct?
Yeah, absolutely. Yeah, we were fortunate enough that because we had started the program in 2012. I mean, there was a recent decision to expand the number of hours, if you will, to becoming a respiratory care technician. So our program again is 21 months, and we're excited that we're able to get students into school for a relatively short period of time, and then out into the workplace. Helping every one of the healthcare environments that need the assistance in and around, how all of us breathe every day.
Mm-hmm.
So again, it's we're excited that we're able to keep the program short, and students are able to get through the program and get into the workforce quickly.
And I know that Vicki Kane, who works with you at YTI, has been instrumental in seeing this happen. And we're going to have another podcast with her coming up about some of the places that these respiratory therapists have landed, with their profession and with their expertise. And you talked a little bit about what is respiratory care, and there's so many different avenues that you can really pursue once you get that degree. And that's really the beauty of the diversity, if you will, in respiratory care. And, I guess the problem, or the blessing and the problem, is that this whole COVID thing, I'd never really heard of a respiratory therapist, but now everybody's talking about them and how really key they are in the care of patients with respiratory issues.
Yeah, no, absolutely. I think, whenever we have, these sort of events, and, I think it brings to light that, clearly breathing is important, and our lungs are obviously very vital to our success as a human.
Right.
And and I think that again, trying to make folks out in the world aware that there are these vocations that require a relatively short amount of time, and and there's a nice blended approach where you can do, again, your sort of lecture and project work and simulated lab work online, in a flexible way, and then obviously getting into a clinical setting where you work on your tangible skills,
Mm-hmm.
and again, we're big on not only the theoretical education and training that goes on, but really applying that education and training in a practical environment, because again, that's what employers are asking of us, so that when they get an entry level graduate of ours, that they are well grounded in a lot of what I'd call the basics, the basic blocking and tackling.
Mm-hmm.
And we take great pride in trying to make sure that every student has a phenomenal experience with us. And again, I would just simply say that respiratory care technicians, it is an academically a little more academically challenging program. So I would just simply say that it's a program that like anything in life, I mean, you really have to sort of stick at it. And with regards to the future, around around the job outlook, if you will. If you look at the Bureau of Labor Statistics, I mean, last time I looked at that, I think through 2024, the projected growth rate for respiratory care technicians or therapists was averaging around 12%. So, there's good opportunity moving forward in this field.
There's huge demand. And, again, you talked about, we're speaking with Jim Bologa, who's the president and CEO of YTI. And it really is, the respiratory program is a blended learning experience. And not only do you get that qualified instruction, which you already have a reputation for, but you also get student support, as well as, the independence and flexibility of online learning. So it really is, a win-win for the lifestyles that we lead today. So finally, Jim, the big question is, you've got classes that are starting in July. How can people find out more information about the program?
Yeah, great question. The easiest way is to go to yti.edu, so yti.edu. Or what we are doing right now is we are holding some webinars, some informational webinars.
And virtual tours.
And virtual tours. And so if anybody has any interest, we're going to be holding some virtual webinars where we're going to be sharing information about all of the programs that we offer at YTI Career Institute. And what we will be doing is from there, soliciting folks in terms of their interest, if you will, in the various programs that we do offer at our campuses in Pennsylvania. And they can go online and have a virtual tour. If they're further along in the process in terms of their decision making, they can always go right online and apply right online as well. So we're trying to make it as easy as possible for prospective students to get the information they need to make a good decision about their future with regards to becoming a respiratory care technician.
Right. And we should also mention that, there's been a lot of downsizing. There's been a lot of folks who've been furloughed. There's been a lot of folks who, really have had to sit at home and think about how to recreate themselves and what the future of gainful employment means. And you're looking at the people who are working today. It's people in healthcare. It's people in the trades. So it only is to your benefit to go to the website. That's YTI.edu. Again, they're signing up for classes now come July. So Jim Bologa, thank you. This was an interesting conversation, and I want to thank folks who listened to this podcast, and hopefully we've given you some additional information and at least piqued your interest in YTI's respiratory therapy program. And thank you for listening.